My name is Matthias Oberg, and I'm a dentist, and I do a lot of wear treatment with F.I.T technique. Today I will use F.I.T as the new F.I.T veneer solution for a direct veneer case. When the patient arrives at the clinic, I welcome them, and we go in for a wish interview so the patient has the opportunity to clarify their wishes.
I have some small but many gaps between my upper teeth that I really always wanted to close. I never really got approval to get a traditional braces, so getting the opportunity to kind of close them here with the F.I.T treatment is a great opportunity to have, and I'm happy about that.
When we get into the chair, we start by taking a 3D scan of the teeth, which we will use to design the new teeth. Afterwards, we take photos so we can create a smile design. A smile design is a facial analysis, so we can digitally design the new set of teeth before we start treatment on the patient. Once we have completed the smile design, we show it to the patient. This is also where we try the design on. Trying it out gives us the opportunity to make corrections and adjustments before we start the treatment. So when I'm about to start the treatment, I polish the teeth, so the surface of the teeth is clean, and try the translucent keys on, and they have to fit tightly. If they do, then I move on to etching the surface of the teeth. And rinse and dry the surface. Then I put Teflon on every second tooth, the teeth that don't need to be built up initially. Once the Teflon is applied, I bond the teeth surface. And once it's light polymerized, I put the transparent key back on and inject the composite. Then I light polymerize through the transparent key, and then I take the key off. And then I light polymerize one last time, and we have to remove the Teflon. And then we're going to remove the overflow. And all the edges just need to be finished. Being careful not to let it bleed. I don't want it to start bleeding at this point. When I'm ready to do the second injection phase, I'll etch the teeth we're missing, I'll bond, and I'll put Teflon tape on the already finished teeth we've already injected. Then I put the transparent key on and I inject and light polymerize, just like before, and take the keys off and light polymerize one last time. I always start the finishing procedure by removing the overflow and removing the Teflon tape. And then I finish the edges, and finally we polish the fine edges and use a combi knife to remove the excess approximately. And then we can do the final polishing at the end. When we're done with the treatment, we take photos again of the patient that we have before and after images.